Okay, hello friends, it's Kimberly here with Specialty Care Management and Reiki and Coaching. Many of you know Specialty Care Management for our unique and I would say game-changing strategies for reducing and mitigating the high costs that are associated with dialysis claims. Now, we're also known for our unique strategies to mitigate costs pertaining to cancer, air ambulance, out-of-network claims, and in particular, our view on mitigating risk is holistic in that we want to find, I can hear Star Trek in my mind. We seek after bold new, right? We look for bold ways to help mitigate risk wherever it lies. And the best way to mitigate the risk for things like dialysis or cancer is to not require them in the first place, right? That's to prevent kidney disease, to prevent cancers, catch them early for dialysis and cancer. When you catch things early enough, a lot of times you can preserve, in the case of kidneys, you can definitely preserve kidney function and improve it. Many people are able to remain off of dialysis indefinitely. Cancers today, the cancer treatment in particular, from when I started nursing 20, 30 years ago, it was a totally different game. A lot of cancers today, we catch them early enough, and many cancers, we have a 90% cure rate. So it definitely makes a difference when you look upstream. And one of our strategies to help folks look upstream is our CKD management program and our Health Reach 360 program. So I wanted to take a quick minute and share another success story. I don't know about you, success stories really speak to me. So let me see if I can share this screen with you. Here we go. And I'll be sharing today, this is a member who, I'm going to make you dizzy for just a minute. Anyway, this member, he's a 61-year-old member, and he's very physically active at work. He's had a history of a gastric procedure. He had a lap band procedure years ago, and yet here he is in this place where his BMI is almost 36. He's not happy with his energy level. He's not happy with his weight. He's feeling frustrated, defeated. And in particular, he's complaining about, the pain. It's getting harder and harder for him to manage a full day's work. And he's looking at, his doctor's talking about putting him on some extra meds, and it's just really difficult. And this was a story that happened around the holidays. Holidays can be huge. They can be deal breakers for members. A lot of times you'll see members, they start off with good intention, a holiday or a special event comes around and totally throws them off. And because they feel like a failure, because they stepped off the wagon for a minute, it's hard to get back on. That those feelings of defeat and letting yourself down can be really overwhelming for members. In particular, his A1C was 11.2. So to give you an idea of what that would mean, his blood sugars are well over 200 much of the time to have an A1C like that. His hypertension, he's in the 140s over, looks like most of the time is diastolic. That bottom number is in the 90s. His cholesterol's elevated, and he's having frequent gout flares. Now, gout isn't only painful, but think about it. Many people don't understand the relationship of gout with kidney disease, but think about it like this. When we have a gout attack, those uric acid crystals, right? They're crystals. So here's a crystal. It's a rock, right? So those crystals, they're not just in big toes or knees, right? They travel through the vasculature and they do a lot of damage to kidneys. So folks with frequent gout flares are not just in pain. They don't just walk around with a sore toe. It's doing a lot of damage to their kidneys. Remember that the filters in the kidneys they're like balls of yarn, right? There's balls of capillaries. They're delicate blood vessels. So things like kidney stones and gout, those crystals can do a lot of damage over time. And here's the other thing, folks that have this nagging pain that interferes with their ability to work, a lot of times they're trying to get through the day. And he would say, when he's asked about, what do you do to control when you're uncomfortable, when you have this pain? Well, he says, Motrin by the handfuls. And Motrin, ibuprofen, Aleve, NSAIDs, non-steroidal anti-inflammatory drugs, they in and of themselves can be nephrotoxic. I've known many cases where people develop kidney disease just because they've fried their poor little kidneys because of too much NSAID use. So that's also a concern in the back of this nurse coach's mind. His GFR wasn't bad. He's sitting at 56. So if you remember from previous conversations with us, a normal GFR, generally speaking, is above 90. Remember, it's more complicated than that, right? Some people can have a GFR 90 and still have kidney disease, but in general, without going into complex pathophys, a GFR of 90, it's kind of like when you get a test back from school and you get a 90 on your exam, you pat yourself on the back, you're doing pretty good. You get a 56 on your exam, you might want to get a tutor, right? If his GFR stays at 56, he's likely going to be diagnosed with CKD3, chronic kidney disease or chronic renal disease at stage 3, if his doctor catches it in time. His main concern before his education was really, truly, he just wanted to get some of the weight off and to cut back on some of his meds. And he was sick and tired of the way that he was feeling when he was ready to engage with the nurse for support. Now, the nurse coach has in the back of their mind all the pathophysiology at play, but understanding that none of that really is going to speak to the member, right? There's a process at play where we educate about the pathophysiology, how that's impacting. In particular with diabetes, people usually there's a lot of guilt at play. The nurse is going to remove that guilt and teach about why he feels the way he does. Why is he unsatisfied after eating a regular meal? It's not because he doesn't have any willpower. It's not because, he has no self-control. It's pathophysiology. That's a huge game changer for these folks. Guilt and shame put people in a corner, right? And it doesn't really help them address the very stimuli that are causing them to feel and behave in the way that they are. So the nurse coach educates about pathophysiology. She educates and helps him figure out the handful of labs, there's 3 or 4, that this member is going to want to track. You can't change anything unless you can understand it and track it. So he's going to understand what a few of these key labs are, how to talk with his provider about that. The nurse is going to help facilitate that communication with the provider. Any barriers that are uncovered, that's a really important conversation. So the nurse can really help the provider to provide their member with better care. It's almost like having somebody in the home, so to speak. Even over the phone, we can tell a lot about a member, and members usually feel more comfortable confessing, right? And really letting out some of their barriers with the nurse than they do with the doctor. So that's super important. And through this coaching, this helping professional kind of relationship, the nurse helps the member identify where he's been successful in the past, how he can capitalize on those strengths, can help him identify triggers responsible for this rebound weight gain, and how he can, in his day-to-day living and the things that he does habitually, how he can create this long-term behavior change that's going to drive him almost effortlessly after the fact to where he wants to be. So the nurse educated regarding, how do these weight loss plateaus happen? How do we manage cravings? Again, going back to pathophysiology, strategies for managing through holidays, what to do about gout, making sure he understood what that means for him. Motivational interviewing, it's basically a coaching framework that helps members uncover their own strategies unique to their own lifestyles that are really going to help them put into play the things that they already know they should be doing, right? Most of us know the things that we need to do. Doing them can be a totally different matter. That's where a nurse coach, and particularly a nurse who specializes in complex comorbid conditions like kidney disease, can be a game changer for these members. This member in particular, after working with a nurse, now this is just initial coaching, it's been going on for a couple months. Now here, after a couple months, he's saying, oh my gosh, he's feeling more satisfied. I'm not hungry all the time anymore. And I was able to say no thank you to banana bread at work today. That's a huge victory. And he's able to make better choices. He had some protein and nuts and some cranberries instead for a snack. And the fact that he reported feeling satisfied is really fantastic. So through this process, he starts to pay more attention to his diet. He starts cutting back on some of those purine-rich foods that trigger his gout, starts cutting back on some of the junk, starts adding more vegetables, fish, drinking more water, and healthy fluids, feeling great in that his gout symptoms are resolving, and having more energy to bring to work is huge. Now, too, it was uncovered through this coaching process that he might have sleep apnea. Sleep apnea doesn't just mean that you snore and annoy your partner. Sleep apnea is a huge driver toward congestive heart failure and contributes to kidney disease as well. So through this process of awareness with a nurse coach, he was able to talk to his provider and get himself scheduled for a sleep study in home, which he certainly appealed to him more than going into a facility for that. And so far, early on, here it's been 2 months, he's lost 7 pounds. This is really feeling like he has more control over his life. He certainly feels more victorious after month 2 than he did at the start. Matter of fact, he tells his nurse, thank you. I appreciate the information and the follow-up calls. I have hope again. That's huge. I don't know about you. I think when I have hope, I know there's nothing that I can't accomplish. So through this early process in this nurse coaching relationship, he's closed 11 gaps in care. So there's over $13,000 in savings. His blood sugars are coming down from an average of 270 down into 200s. Being able to get on a CPAP machine if he's diagnosed, I haven't heard yet, if he's been diagnosed with sleep apnea and he gets on a CPAP machine, that can help avoid congestive heart failure, which not only prevents a whole host of other problems related to that pathophysiology, but also helps to avoid his kidney disease, or help avoid kidney disease. In improving his management for his diabetes and gout, and avoiding, the complications and sequelae that go along with congestive heart failure, there's a huge advantage to this member. If he hasn't been diagnosed with kidney disease already, the hope is he won't be. And if he does have kidney disease, many members, just like him, they're in this place where their GFRs have just dipped under 60. A lot of times they can stay in that range their whole lives and it never progresses. They don't feel bad. They don't have any of the other problems that we associate with kidney failure. And we can keep them there. He can stay there in his self-care. Once you have a diagnosis of kidney disease, you never get rid of it. Even when you improve your GFR, you can definitely go from a stage 3 to a stage 2, right? And you can definitely improve your kidneys function, but you always have that diagnosis. So this is a huge win. And I can just imagine where this member is going to be in another 2 months. Most of the members that work with our nurse coaches through our CKD management program and our Health 360 program, they work with a nurse coach an average of 6 to 8 months. They meet their goals and they're discharged. They don't need to keep the nurse dragging on as a friend. We're expensive friends, I'm just saying, right? But I will say that the work and energy that a nurse coach, a specialty nurse coach, and a member do, it can pay off in spades for years and years to come for the member and for the group. And I'm really glad to share that story with you today. Stay tuned at the end of the month here. Our Sean Whaley is going to share another amazing case study. And so more to come. Make it a great week. Bye.